think it's important to get rid of these things as soon as possible, at the opioids. Because you don't wear collars after the operation routinely, you're probably more likely to get rid of them quicker than the patient group in Canada that I've seen, that have the collar, then have muscle spasms, continue to be on the medication because of those muscle spasms, and we really have to push them to sort of take off the collar, try and move their necks again in order to sort of then slowly reduce it. I'm a big fan of getting rid of opioids because when you take them for a long time, you can actually learn pain, and the opioids can cause pain. So if you have pain, then it's always good to see whether you can drop your opioids and see whether it makes a difference. But with pain, it's a very complex problem, and often it's important to work with a pain specialist in order to optimize that kind of.
I might try to use one of our guys who actually a better answer, but I think the pain is a really complex problem, and we now know if you have poorly controlled acute pain, you're more likely to have long-lasting chronic pain. So, whilst we'd like you to be medication-free, if you're medication-free and experiencing lots of pain, then that might be problems in the future. So it's a very delicate balance. And people who have pain for long periods of time become more and more sensitized to pain. So although they might have had high pain thresholds at the beginning, they actually, their pain thresholds lower and become more sensitive. So for a fine balance, there's something like come along which every other person finds a lot more.
Stopping the flow, because like I said, you can't just stop when you go.
No, you have to work with your GP. But the gabapentin is a different drug, completely. I don't think there's any long-term, problems with the gabapentin. It doesn't sort of cause addiction.
The cold turkey effect, or is it the gabapentin?
It's the cold turkey is the opioids. The gabapentin can screw you up, so you don't want to stop that. But it's not the same sort of kind of cold turkey.
No, so the cold turkey or the tramadol thing, the gabapentin again is the so I think if you've been on a long time,
you have to work with your GP. You just can't decide to do it yourself. The gabapentin, I think, is actually, there's more and more studies coming out that it might have some other beneficial effects that we don't understand yet fully. So if you can tolerate the gabapentin, and it helps a bit with your nerve pain, and this is another thing, there's so many different pain that you can have. You can have your arthritic pain, which potentially could be treated with the morphines at the short run, and with non-steroidals such as ibuprofen, and that might be helpful. And then there's the nerve pain, and these drugs often don't touch the nerve pain. The burning sensation, the thing that you have at night. Tell me a drug that works. It's very difficult.
That's what I tried more. So amitriptyline is probably the better one. It's basically something that knocks me to sleep. If you sleep through it, then you're okay.
Yeah. I think that's a very good drug, actually.
Can the analgesia, such as the neuropathic analgesia, muscle relaxants, etc., can they hide the signs of CSM during assessments?
What do you think? I don't think so, because the things that we look at is the dexterity. We'll ask the questions that we've done today. You'll tell us that it was worse yesterday than it is today, for example. It may sort of influence the way that your whole quality of life is perceived. If you have no pain, obviously, you're a different person. So, but often, whenever that doesn't happen very often.
I'm just thinking, I don't know whether the muscle relaxants, because obviously we do feel the change in spasticity once someone's on backing down things, don't we? So that potentially, if you've got those things, I guess you could see some differences.
I think our clinical assessments are not sensitive enough to notice those changes.
Is that an option for people?
Yeah.
I've never been offered it.
I think specificity.
You go on,
And it's got to be specific. I've done that.
So, are we concluding it's possible that the symptoms can be hidden? I'm not sure.
I think it's probably they are. Certain symptoms are, others not. I don't think not taking the drug before you see a doctor is a good idea because our clinical assessments are not sensitive enough.
So, it certainly wouldn't change things like